again. I'm Dr. Richard Wojciechowski from the Animal Clinic at Oxford Mills. Today I'd like to talk about allergies in pets. Now with this hot weather we're having, there's a lot of heat and humidity, you'll have a lot of people having severe respiratory allergies. And the problem is the microscopic mold that's in the air. A lot of the weather reports will even say how high the allergy season is, and at this time it's the microscopic mold. Other times of the years it could be pollen, dust, mold, mildew, hay fever coming up. And so we'll talk about what we see with our pets. And of course I need another pet to talk about. And this is Izzy Savage. Now, dogs and cats have the exact same allergies that people do. And that could be anything, again, dust, mold, mildew, pollen, hay fever. And right now, we're going through a tremendous allergy season in the pets. Now, the same allergy that will cause a client or any person to have a runny eyes and nose will cause a dog or cat to have skin problems. It's the same cause of the allergy, different symptoms. What they'll have is anything from the skin, and on cats especially, skin, you'll have lesions on the face, they'll be licking themselves, and you could also have ear problems. Now with the dogs, we're seeing a tremendous amount of them coming in. I would say 75% of what we have seen in the last week are dogs coming in with skin and ear infections. Again, the exact same allergy that people have. I'll have clients sitting in the room talking to me. They'll have headaches, they'll have a runny eyes and nose, and their dogs or their cat will be in the exam room with major skin problems that are related to the exact same allergy. Now as far as treatments for the allergies, a lot of people will use antihistamines they have at home. Now, first of all, if you're going to use the antihistamines, call your veterinarian and find the right dosage. Most people do tend to use too low of a dose for it to be effective. The antihistamines can work slightly, but normally you'll need a lot of extra medications, anything from cortisone to sometimes secondary infections will need antibiotics. And again, talk to your veterinarian. He or she will look. There also could be major ear infections related, again, to the allergies. Another allergy that we see, and we'll be seeing more now, will be the flea allergy. Now with the flea allergy, it's different than an animal just having fleas, because a cat or dog can come in and we can find anywhere from 2 to 4, maybe even 10 fleas, and there's not even a symptom. No scratching, no irritation. Where we can have another pet come in and the body can just be ripped apart from the intense itching, the scratching, and the biting. Now that particular pet would be allergic to the flea saliva. Now there's a difference again. A lot of pets have fleas, may have a little itch here and there. Where you have a dog or cat that has a flea allergy, you have a tremendous skin problem. And it only takes 1 or 2 fleas. It could bite a cat like Izzy. 1 flea could bite him on the head, on the tail, but the whole body would react to it. And then when you're dealing with the flea allergies, then you have to, number 1, give medication to stop the symptoms. You want to give your pet as much relief as possible. And at the same time, you want to try to get rid of the fleas. Now there are different ways of doing that. And the best way, of course, is check with your veterinarian. He or she can direct you to the best treatment for the symptoms and also how to get rid of the fleas. The thing about getting rid of fleas, you want to do it safely, not only for your pet, but you want to use some product that's going to be safe for your family to be around. And this is Richard Wojciechowski. Thank you so much. And as he says bye,